Do your calf muscles suddenly tighten while you're sleeping? After 75 recurring nighttime leg cramps, shouldn't automatically be dismissed as just old age. Before reaching for home remedies, it's important to understand what may actually be causing your nighttime leg cramps. We'll cover evidence-based information to help you make informed decisions about your health. Point 1. Muscle fatigue can increase the risk. Even routine daily activities can leave aging muscles more susceptible to cramping. Walking longer than usual, standing for extended periods, or using muscles that haven't been exercised regularly may increase the likelihood of nighttime cramps as people age. Muscles naturally lose mass strength and flexibility. This means muscles tire more easily than they did years ago. Activities that once felt effortless may now place greater strain on the calves and other leg muscles. When these muscles become fatigued, they may not relax as efficiently, making sudden contractions during sleep more likely. It's important to remember that physical activity remains one of the best ways to maintain mobility and independence after 75, however. Increasing activity too quickly or doing more than your body is prepared for may increase muscle fatigue. Gradually building endurance, taking rest breaks when needed, and allowing muscles enough time to recover can help reduce the likelihood of nighttime cramps while still keeping you active and healthy. Point 2. Overworked muscles need time to recover. Surprisingly, doing too much physical activity can also trigger nighttime cramps. Muscles that become overly fatigued during the day may be more likely to contract unexpectedly while you're asleep. Whether you've spent hours gardening, walking farther than usual, climbing stairs repeatedly, or standing for long periods, your muscles require adequate recovery. Recovery isn't only about resting. It also includes proper hydration, balanced nutrition, and sufficient sleep. Without enough recovery time, muscle fibers may remain irritated and become more prone to painful spasms later that night. Rather than avoiding activity altogether, aim for consistent, moderate exercise that matches your fitness level. Gentle stretching after activity and allowing recovery between strenuous tasks may help reduce muscle fatigue and support healthier muscle function over time. Point 3. Dehydration may be a hidden trigger. Many adults over the age of 75 experience a reduced sense of thirst, making dehydration easier to overlook. Even mild dehydration may contribute to muscle cramps in some individuals because muscles depend on adequate fluid balance to function normally. Hot weather illness, certain medications, and increased physical activity can all increase fluid loss. By the time you actually feel thirsty, your body may already be lacking enough fluids, unless your healthcare provider has advised you to limit fluids due to conditions such as heart failure or advanced kidney disease. Drinking water consistently throughout the day may help support healthy muscle function, rather than drinking large amounts all at once. Try maintaining steady hydration from morning until evening, combined with a balanced diet and regular activity. This simple habit may reduce the likelihood of recurring nighttime cramps. Point 4. Sitting too long can tighten your muscles. Long periods of sitting or lying down may cause calf muscles to become stiff. Gentle movement, short walks, and changing positions regularly throughout the day may help keep muscles flexible and reduce the likelihood of nighttime cramping. Point 5. Stretching before bed may help. Simple calf stretches before bedtime have been shown to reduce nighttime leg cramps for some people. Stretch slowly without bouncing and stop. If you experience pain, a consistent bedtime stretching routine may be more beneficial than stretching only occasionally. Point 6. Mineral supplements aren't always necessary. Many people believe nighttime leg cramps are always caused by low magnesium or potassium. In reality, mineral deficiencies are only one possible cause. Taking supplements without medical advice may not help, and could even be harmful for some individuals. Certain medications can contribute. Some prescription medications have been associated with muscle cramps in certain individuals. If cramps begin after starting a new medication or become noticeably worse, discuss the symptoms with your healthcare provider instead of stopping the medication on your own. Point 8. Proper footwear supports muscle health. Supportive shoes can reduce unnecessary stress on your feet and calves during daily activities. Wearing shoes that fit properly may help improve comfort and reduce Muscle strain that contributes to nighttime cramps. Point 9. Sleep position may affect your calf muscles. Sleeping with your toes pointed downward may shorten the calf muscles, making cramps more likely for some people. Adjusting your sleeping position or gently stretching before bed may help lower the risk. Point 10. Frequent cramps should never be ignored. Occasional nighttime leg cramps are common, especially in older adults. However, when cramps begin occurring several times each week, repeatedly interrupt your sleep, or become increasingly painful, they deserve medical attention. Persistent cramps may sometimes be associated with medication side effects, nerve disorders, circulation problems, or other medical conditions that require evaluation. Keeping track of how often cramps occur, how long they last, and whether they affect one or both legs can provide useful information for your healthcare provider. This information may help identify patterns or possible contributing factors. Ignoring recurring symptoms simply because they happen at night may delay the diagnosis of a treatable condition. Seeking medical advice early allows your healthcare provider to determine whether further evaluation or treatment is appropriate. Point 11. Watch for warning signs that require prompt medical care. While ordinary nighttime leg cramps usually resolve within minutes, certain symptoms should never be ignored. If a cramp is accompanied by significant swelling, redness, warmth, severe weakness, numbness, fever, or changes in skin color, medical evaluation is recommended as soon as possible. Persistent pain that continues long after the cramp has ended, or difficulty walking normally, may also indicate a condition other than a simple muscle cramp. Although these situations are less common, recognizing the difference between a typical cramp and a more serious problem is important. Seeking prompt medical attention when these warning signs appear can help identify underlying conditions before complications develop. Point 12. Healthy daily habits can reduce your risk. There is no guaranteed way to prevent every nighttime leg cramp, but healthy daily habits may reduce how often they occur. Staying physically active, drinking enough fluids when appropriate, eating a balanced diet, and maintaining regular sleep habits all support healthy muscle function. Light stretching before bed, avoiding sudden increases in physical activity, and giving your muscles enough recovery time may also make a difference. These simple habits often work best when practiced consistently rather than occasionally. Although improvements may take time, many older adults notice fewer nighttime cramps after making gradual lifestyle changes. Point 13. Avoid relying on unproven treatments. Many products marketed for leg cramps promise fast results, but not all have strong scientific evidence to support their claims. Before trying supplements, herbal remedies, or over-the-counter treatments, it's best to discuss them with your healthcare provider. Some products may interact with prescription medications or may not be appropriate for people with kidney disease, heart disease, or other chronic health conditions. Choosing treatments supported by medical evidence is generally the safest approach for managing recurring nighttime leg cramps.